For many people, gaining access to quality mental health care and services is not easy. In fact, it can be harder to access mental health care than physical health care, even though it should be covered equally by insurance. Now, more than ever, we all need to come together to change things for the better, for everyone. It's important to keep in mind that mental health equality and equity are not the same thing. How are they different? Equality is making sure that mental health resources like therapy and psychiatric care are available to people in general. Whereas equity is focused on the accessibility of mental health resources. For example, equitable mental health services provide necessary accommodation for those with disabilities, language barriers, or other challenges. For example, Black and Latinx people experience more day-to-day stress as a result of these systemic barriers. More stress requires more access to resources like mental health care. Some communities, such as the BIPOC community, often have less access to mental health services and may be less likely to receive appropriate diagnosis and treatment for mental health concerns. Equitable access to mental health care and services can help. The earlier the access, the more it can positively impact your entire life. So, what can we do to promote mental health equity? 3 things everyone can do to promote mental health equity are: 1. Be a mental health advocate. Advocacy starts with listening and working to understand others. Your voice matters and can help make a change. Share mental health resources and talk about the importance of discussing the topic of mental health on your social media. Then, speak out against systemic barriers and speak up for supporting people harmed by these barriers. Boost what they have to say to support each other. You can also sign up to be a volunteer advocate and help push for important legislation related to mental health through the American Foundation for Suicide Prevention. 2. Start where you feel comfortable. Try getting involved with your local mental health groups or organizations, such as National Alliance for Mental Illness or the American Foundation for Suicide Prevention. Groups like this can help to educate you on steps you can take to make an impact on mental health awareness in your local community. 3. Learn. Encourage more equitable mental health care by educating ourselves about different cultures, racism, oppression, privilege, and other factors that impact the BIPOC community. Speak up about more cultural diversity and multilingual staff among teachers, coaches, and leaders in the community you live in. Learning about equity and mental health will help you know how to raise awareness about the importance of being culturally responsive for everyone. Everyone should have effective and accessible mental health care, regardless of their ability to pay, citizenship status, or where someone lives. Together, we can improve the lives of those who are most impacted by mental health inequities. Starting with these 3 actions. It won't be easy, but it will be worth it. If you or someone you know is experiencing mental health symptoms, you can contact a health professional to learn more about mental health equity and treatment options. To learn more about resources and ways of supporting teen mental health, please visit afsp.org. To learn more about mental health resources, visit psychhub.com.